So I'm trying to think what I can remember about my situation. So I've had some documents as well. As far as I know, I was injured in 2015 and it was a suicide attempt. And the result of that was broken bones and some internal injuries and whatever. And I had to go to hospital. Um, I'm not clear on the dates. Um, I don't know if the information I've got gives me dates, but I think it was definitely 2015. Um, I'll see what I've got here. Some of the information they got on my educational history is not quite right. So I need to correct them on that at some point. They've underestimated how I did at GCSE, I think. I don't have anything that clearly says when I was injured. No, I think it was on the. Well, I was admitted to the Royal London Hospital on the 3rd of May 2015, falling from a height of 24 feet. So I had brain injury, bone injuries, a fracture of one of my spine vertebra, several fractures of my ribs. And it says thoracic fractures. I'm not sure what that means. Quite a few issues to do with the brain injury. I'm not gonna list them here. Or maybe I will. Bilateral extraaxial hemorrhage, bilateral frontal and temporal lobe contusion, right carotid artery dissection, right parieto-occipital infarction, and bony injuries with skull vault and base of skull fractures, commonly displaced fracture of frontal and nasal bones, fracture of right squamous bones and petrous and temporal bones, disrupted right ossicles, as well as fracture of the left zygoma, unstable fracture of 7th cervical vertebra, multiple thoracic fractures, as well as crushed fracture or 2nd lumbar vertebra, bilateral rib fractures, and visceral injuries were pneumothorax, extensive lung contusions, and brain injury was bilateral extraaxial hemorrhage, bilateral frontal and temporal lobe contusion, right carotid artery dissection, right parieto-occipital infarction, and cranioplasty was performed on 4th to 7th 2015. And then there was hydrocephalus 4 days post-surgery, which was managed by insertion of ventriculoperitoneal shunt. I was then transferred to North Mid Hospital in late July 2015, where a peg was inserted to maintain hydration and nutrition. A CT brain scan showed bilateral extraaxial hematoma, bilateral frontal and temporal lobe contusions, as well as bilateral extensive pneumocephalus. I underwent decompressive craniectomy. I was admitted to the Regional Hyperacute Rehabilitation Unit, RHRU, on 11th to 11th 2015, and I was an inpatient rehabilitation. And I had a peg.